So without any further from me, I'd like to introduce Nas Campanella. She's the ABC's Disability Affairs reporter. She holds a communications degree at the University of Technology, Sydney, where she majored in journalism. She began her work with ABC as a cadet before working as a regional reporter for Triple J, as many of us know her voice from. Nas is totally blind, and she lives with a neurological condition that prevents her from reading Braille. She was the first blind newsreader in the world, and she's a great friend of my neighbour. So please join me in welcoming Nas.
Thank you, Gillian. And like you, I also feel quite strange doing a presentation. This is only the second one I've done in 12 months that has actually been in front of a live audience. So treat me kindly, and we'll see how we go. I want to start off by getting you to close your eyes. I want you to think back to your early childhood. What was it like? What are some of the memories that pop up when you think about those early days? Hopefully for many of you, it's smiles, hugs, laughter, sand between your toes, running barefoot on the driveway, whatever it might be. I'm sure it's memories of joy and happiness and lots of family time. I have those memories as well of my childhood, but the ones that really stick out are ones of mostly being in hospital. They're memories of feeling needles stinging into the crooks of my elbows, feeling numbing cream or struggling to get a cannula in the back of my hand, doctors talking about me, not to me, and my parents feeling increasingly frustrated by going to the same specialists or seeing the same nurses at the same facilities over and over again and being asked the same questions, or being asked to repeat the entire history and what had happened to my vision. A lot of them are memories of feeling incredibly anxious and shaking uncontrollably before going into theatre and needing a warm space blanket to calm me down. So much so that I could never remember, or at least never had the ability to say my name or my birth date so that the nurses could check that I was the right patient and that I had the right wristband on. My dad always used to come in to theatre with me and stay until I fell asleep. That was one of the special memories. And for a long time, I wasn't able to go into theatre on my own. In fact, the first time I did was for a minor procedure last year at age 31. Sometimes even now, I'll smell certain things, Dettol, nail polish remover, and they'll remind me of hospital. And I'll instantly be transported back to that time, back to those traumatic situations where I didn't want to be there. There are also things like colour. And for someone who has no vision, maybe that's a little hard to understand, but I have this vivid memory of seeing white hospital walls and sheets. And I have no idea if it's the same white that you see, but for me, white is not a pleasant colour. So much so that when I got married 3 years ago, everyone just knew instantly that I wasn't going to walk down the aisle in a white dress. So I remember having these situations happen over and over again, where I'd be held down and people would try and obviously convince me to have needles or to have surgeries. And I would plead with my parents and the doctors that I didn't want surgery. I didn't want countless procedures to try and fix my sight. At age 9, I bribed Mum for a Posh Spice Barbie doll so that I could have surgery. So that was the only way that I would allow her to let me do the surgery. At age 10, it was, Mum, I'll only have the surgery if you let me go to a fancy hair salon and dye my hair blonde. As I got older, it was things like a new pair of high heels, makeup, until my mid-teens, where I said, I'll only do this surgery if it's the final one. I wanted to be happy. I wanted to be a normal teenager. And I wanted to live my life blind. I wasn't interested in cures or being fixed. And I think that was something that was really hard for both the doctors and my parents to understand. Initially, when I had my diagnosis, which wasn't really a diagnosis, even today it's still known as a rare retinal abnormality, it was almost declared to my parents as something that would be negative, hard, challenging, this difficult life that would never, in a sense, be lived to its fullest. And that simply hasn't been the case. But at the time, it's what my parents were fed in terms of information, and I fed off that. And their frustrations with negative things that people said also fed to me. And so I started to feel as a kid like things needed to be fixed, or that I needed to find a cure. I felt like a guinea pig. I was often being flown to some weird and wonderful hospital across Australia where someone had come from overseas with a new technique or a new procedure that would be touted as something that would fix my vision. And it never worked, clearly, because I still have no vision. But it started to become just part of life that every now and again I was pulled out of school and I would miss out with learning and I would miss out on time with my friends. And I wasn't living my best life because I was in and out of hospital trying to be fixed and cured. And so that day when I said to Mum, I'll only let you put me to sleep so we can do this last surgery if it's my final one, was a real moment for my parents. It was a moment of going, why are we doing this? She's really happy. She's okay. And it's time that we listen to her. And it was my mid-teens and it was the first time anybody had listened to what I wanted in regards to my health. And for me, that last surgery, I came out of it and I felt for the first time utter relief, because I felt like it was the last time that I was going to have something done that was against my will, that wasn't discussed with me properly. Of course, I've had other surgeries since then, but there have been ones where they've been my choice. They've been discussed with me. Information has been given to me so that I could make my own decisions. And as I got older, I was able to advocate for myself and advocate for the sorts of accessibility that I needed in healthcare. That was things like explaining to doctors that you can't just show me a diagram. You need to actually take my hand and you need to show me, trace my hands around a diagram to show me what something looks like or what part of the body it's in and what you're going to be doing. You need to articulate in very simple language what you're going to be doing and how it's all going to work. I learnt along the way what I needed. And so whenever I go into hospital, I'll say things like, just please don't put anything on my face until I'm asleep, because then I won't know it's there and I won't feel the claustrophobia and I won't be anxious. Talk to me until I go to sleep. All of those things have helped along the way. But as I said, for the first time, going into surgery last year as a 31-year-old, and I said to my husband, this is the first time I've ever gone into surgery on my own. And it felt really silly to say that. But on the other hand, I was incredibly proud that I had come this far despite everything that had happened. I know that I'm not the only one who's experienced this kind of trauma. A recent anthology entitled Growing Up Disabled in Australia has been released, and it's 47 stories written by people with lived experience of disability. Not parents, not carers, because those aren't lived experience of disability. While important, they are observed experience of disability. These 47 people all have incredibly different stories. Why wouldn't they? We're not a homogenous group. But one thing that stuck out to me in reading this anthology was that we all had some form of experience with trauma. And a lot of it had to do with medicine. If not for the way that we were treated or spoken to or not spoken to, then an experience of viewing disability from the medical model, that is, needing to be fixed or cured. Some of us in the disability community don't want to be fixed. We don't feel that way about our disability. We're incredibly proud and see it as part of who we are. And I know it's really difficult for some people to understand that, because why do you go into medicine? You go into medicine to make things better. And I think sometimes you need to understand that everyone's life can be seen in such a different way. And it's all about how we frame disability. So in my role as Disability Affairs reporter, in the last year, I have covered some incredibly tragic stories. Stories of women having a pregnancy scan and being told and given information to have an abortion once a diagnosis of Down syndrome for an unborn child is discovered. Not encouraged, not given just information to make their own decision, told it's what you should do. I've also covered stories where autistic women have struggled with mental health their entire life. They're more susceptible to eating disorders, anxiety, and depression. And yet when they go into a doctor's surgery, they're made to sit in a noisy, overstimulating waiting room. How can they be blamed for having meltdowns when they are in sensory overload? They often walk into a surgery and find that it's hard to understand multiple parts to a question. There might be 3 parts to a question that a doctor's asking. And autistic people need more time to process. And so while you're on the 2nd or 3rd part of that question as a doctor, an autistic person might still be thinking and considering and listening and taking in the first part of your question. And they'll miss the 2nd and 3rd part. And autistic women have told me that that's rarely understood or taken into consideration. Autistic women in this particular story also told me that for them, knowing who they're going to see, the environment they're going to, is it going to be the same? Is it going to be the same doctor? It takes an incredible amount of processing time and energy to get used to an environment or to people and to the kinds of language that's going to be used in an appointment. When that all changes all of a sudden, that person finds it hard to therefore understand who they're seeing, why they're seeing them, and it makes it really difficult to go ahead with an appointment. I've also covered other stories relating to COVID-19, of course. And one of them in particular has been the use of telehealth. Now, people with disability have been crying out for telehealth for decades. I spoke to one woman who hasn't left the house or her bed in 20 years because of chronic illness. And she was absolutely delighted when telehealth was accessible for her, but so terrified at the same time that when COVID ends, whenever that might be, that it will just be taken away. For some people, telehealth, like me, for example, has meant that it's so much easier to get to an appointment. I don't have to rely on my husband or expensive transport to get there. I can just do it from the comfort of my own home. But for others, for example, in the autistic community, it's been a struggle. I did a story on women who were unable to continue with psychology appointments because they simply couldn't tell the difference between home life and the psychology appointment, because all of a sudden that psychology appointment had entered their living room. I guess I want to say that I'm not sharing these stories to put anyone in a naughty corner or to make anyone feel bad. I'm also incredibly supportive and grateful to the medical profession, and have been, and wholeheartedly believe in everything that you do. But I think what I want to really get across is that everyone is unique. We all have very individual needs, and we should be treated in that way. We're individuals that all have a very unique perspective, and you should include us in our own care and not just talk to our carers and family members. And if we don't communicate in non-traditional ways, if we're non-verbal, if we don't communicate through written or spoken language, find a way to communicate with us. There is always a way. Thank you very much for having me here today. It's an absolute pleasure to come and share some of my personal and professional experience with you. And I look forward to, hearing some of the words you've come up with and also some of the questions that you might have around healthcare. I really support and believe in everything you do, and this session is really about helping you all become better practitioners so that you can serve people living with disability. There are 4.4 million of us in Australia. If you don't cater your services to suit us, that's 20%. I think so. I think it's 20%. My maths isn't good. 20% of the population that you are underserving, and that's a travesty. Thank you very much, and I look forward to continuing the conversation.
Thanks so much, Naz, for sharing those stories, your own and others, and your reporting on the Disability Royal Commission is going to give us so much to think about. I think you were talking about communication needing to be accessible in healthcare. Communication in general about health issues needs to be accessible to everyone in the media, and we're going to introduce ourselves in just a second. But I think the lack of representation of disabled people having lives and not only being inspirational stories or someone to pity with a terrible thing going on, that's a big part of perhaps why, as health professionals, we are not prompted to think about people's access needs. So really, this session is not at all supposed to be an us versus you or us versus them situation. It's just talking about how we can make sure that we actually remember that people have different needs, so then we provide great healthcare.